Hey guys, it's Ted Bogert with the Ted Show. We're back with a fresh episode 801, after yesterday's crazy mantra that I threw out there. I am very excited to have an alumnus with us. Dorine Olive is on the show. She is back. We're going to be talking about cancer awareness. The greatest wealth is health. And we also have, as a new guest, Karen Ingalls on the show today, and we're going to be talking about their journey. And hopefully we'll have Dr. Holloway pop on when he is ready on his break. So welcome to you both, and thank you for coming on the show and talking about how this very, very important topic. So Dorine, I'm going to start with you, and then I'd love for you to introduce Karen to us. Tell us a little bit about your journey again and who you are for those people who didn't catch the show back in October.
Absolutely. So on August 23rd, 2019, I was diagnosed with ovarian cancer very, very unexpectedly during my hysterectomy. So that obviously led me to a complete change in my life. And so obviously I just celebrated 1 year cancerversary.
Woohoo! Congratulations.
And through actually that whole journey, I was introduced through Dr. Holloway to Karen, and she was able to certainly be a support to me, and I was able to ask her a lot of questions of things that I wasn't sure what I was going to be encountering, and when I was encountering things, and of course everybody's experience and what they endure. What I've learned through all this is so completely different. Each person, how they react to the chemo and the side effects and those sort of things. So on that note, I'll let Karen share a little bit about her story.
Yes, Karen, welcome to the show. I am excited to hear how you fit into all this journey and how you got here. So welcome.
Well, thank you. And thank you, Ted, for having both of us. And when Dr. Holloway comes, we have a very important message. And I was diagnosed with ovarian cancer in 2008. So I'm celebrating 12 years.
Woohoo! Congratulations.
I have 2 recurrences, but I'm 3.5 years in remission from the second recurrence. And I'm a retired registered nurse. And I knew nothing about ovarian cancer. So it was very exciting journey for me to learn about ovarian cancer. And my passion now is, and has been for the last 12 years, is for nurses and doctors to really know ovarian cancer symptoms and don't just say, oh, well, you're old, oh, it's postmenopausal, oh, you're just a woman, and end up like Gilda Radner, sent from doctor to doctor to doctor. So that's my passion, and I'm Dr. Holloway's patient, and I think the world of him.
Well, I think it's so important what you just said, because I feel like even with my cancer, which prostate is mine, and it's usually, people kind of, it's almost like the fluffed off cancer. It's pretty hilarious kind of. But so even with mine, I had to push. I had to be my own advocate because I had no other symptoms but 1 or 2. And I'm like, I know, but let's just do the tests. And when the results came back positive, they were as astounded as you possibly could be. So what you're saying is you need for the healthcare workers, the healthcare professionals, to be educated enough to not fluff it off, to listen to you all as your own best advocate.
Why not, when the woman comes in and the number one symptom, the most common symptom is bloating, which was my only symptom. And at 67, I thought, well, okay, women gain weight after menopause. But if the doctors would first think, I wonder if this could be ovarian, and get a CA-125 and an ultrasound. At least rule that out before sending me home or through different physicians. And so that's my big advocacy. But also, secondly, women need to listen to their bodies and act on them. And it's sometimes intimidating, particularly if it's a male physician, for us to kind of say, no, I want a CA 125. I want a pelvic exam. I want an ultrasound. That's not always easy for women to do.
Was that your experience, Dorine, or you had gone in for surgery and had no earthly idea? Is that right?
That's correct. However, what led me to that is very similar to Karen, is that I had the bloating, but because I had just been to my GYN 4 months earlier, I had this false sense of security that, well, I was just at the doctor and nothing was discovered. So, you know, maybe I am gaining a little bit of weight, but I discovered my mass actually while I was doing yoga. And just every time I would do these certain poses, I kept feeling it. And finally, after about 2 months, I said, you know what, I think I should get this checked out. And I got it checked out. Dr. Holloway said, you know, let's do a hysterectomy. But my CA 125 actually came back perfectly normal. So when I woke up from the surgery, to be told that I had ovarian cancer was definitely very much a shocker to me. So
I just remember you were so good, and I have to give you kudos. Every chance I get, I try to give you kudos, because you were so good about updating people, whether it was painful or not, about your journey. And we were talking before we went live how critical I think that is, when you can be brave enough and strong enough to go, this is important for me to share. I think you make a huge impact. I now know you as the teal lady. Yeah. I knew you a lot before that, but the travel lady and all sorts of things, and the funny and the happy lady. But when I think of somebody who's an advocate, even during your own pain for other people, I absolutely think of you. And I know that couldn't have been easy, right?
Well, it wasn't, but we started with the very first week of doing a live update, and had no intentions of having it morph into a weekly update. But every week there was something new that I learned, either a side effect or what I was going to be going through as far as the treatments, and my fear of the psychological attack as time went on, knowing I was having all this poison pumped into my body. And so I was on a mission. And once I started, no matter how bad I was feeling on that Saturday morning, it was critical for me. And I wanted to be raw and real. So I wanted everybody to see even the painful days and the days that I was, in tears at times, but I wanted everybody to see, because what my personal experience, the only thing I've ever related with people who have had cancer is that, they can get tired after their chemo, or they may, throw up, have that type of sickness. But that was really all that I had ever heard. And so there is so much more that's happening behind the scenes. And I just want people to see and really understand, and again, reach out and ask me questions, because I love sharing the story and educating people. So,
is that what you do, Karen, at Dr. Holloway's office? Are you like an advocate, liaison kind of education person? Explain kind of what your role is.
Yeah, I wrote a book about my journey with ovarian cancer, and I have done a number of workshops, one for a pharmaceutical company, one individually. I've started 3 support groups in the Lake County, Sumter County area. I have a blog. I'm writing about it all the time. And I'm like Dorine. It's important for women, but anybody who hears the word cancer, we all immediately think death. And that's not true. That is not true. Yes, there's a high incidence with ovarian, but the statistics are becoming more and more in our favor.
Why is that?
Better chemotherapy, better surgical techniques, and the education that women are paying attention to now. You think back, well, you're too young, but you think back 50 years ago, women never palpated their breasts. There was no such thing as mammograms. And women were dying of breast cancer all the time. Now, unfortunately, with ovarian, there is no reliable test and there is no way to check ourselves. But the education, if we have any of the symptoms, if we act on them within 2 weeks, our mortality rate decreases because it's treatable.
Right.
So, and yet there are women that are stage 3C and 4 that are surviving 20, 25 years. And I do believe it's better techniques and better chemotherapy. I want to also add,
go ahead, I'm sorry.
Before I was diagnosed, and I've been always a very holistic person, I said, I'm never going to get chemotherapy. That is poison.
Yeah.
I'm going to be Suzanne Summers.
Yes, of course.
And like Dorine, I did not anticipate this diagnosis. And when I woke up and the next day the doctor came in and he told me and he said, you're going to need chemotherapy. I said, when can we start? I didn't blink an eye. I didn't hesitate. So chemotherapy certainly has its side effects and it has some issues, but all in all, it's the best recourse.
It's interesting because mine was radiation and I stage 1. And it's funny, I almost felt guilty because people associate radiation and chemo. I've talked about this on the show several times. I didn't lose any weight, folks. I wasn't getting sick. I didn't feel nauseous very much. And so people are like, now you're still going through treatment, right? So it's different for each person. But I love the fact that you talk about how the advocacy of your own self is so important. What were some of the symptoms, or what are some of the symptoms specifically to ovarian cancer that you all put out there to let people know, hey, these are some things you should look for if you're feeling this?
Well, certainly bloating, and Dorine can chime in on this, is, as I said, the most common symptom. Something like 70% of us have that. Back pain, pelvic pain, abdominal pain, change in urination, bowels, inability to eat a meal like you used to, and now your plate's getting smaller, feeling full too soon. Do you want to pick up from there, Doreen? I don't want to.
I think you hit on the main ones that are that people are able to identify with. I'm not sure that there's really any others, but and that's why it's so hard to detect, because when you feel a little bit of cramping or pain, you don't think a lot about it because you just think, okay, well, maybe I have to go to the bathroom, or maybe this is just a menstrual cramp or something. So that's why you really, really have to pay very, very close attention. And when you do go to your doctor, like Karen said, women for breast cancer, we have mammograms, but we don't have anything for ovarian cancer. And I really think we should start testing for CA-125, doing the blood work, and as well as doing the pelvic ultrasound, because those are the two things that can certainly help identify or make you go to the next step to get checked further.
What would be the objection from a doctor to just do that test? Do you all recommend, the ovarian cancer community, is the recommendation to have it at a certain age or only wait till you have symptoms? Women get mammograms before they have symptoms. They're constantly checking. Is that what is it C125? I'm sorry, the blood test. Do they push back on that? Are they not wanting to run that as sort of a preventative, let's take a look?
It's all insurance.
Yeah.
Insurance driven. So.
It's not an expensive test. You could say, I want it done and find a lab, but then to have the doctor read it and follow through is another issue. Right. I don't think women need to have a CA-125 or the pelvic ultrasound unless they're showing one of the symptoms. Two other symptoms I want to touch on: the extreme fatigue that goes on day after day after day. And one of our 25-year survivors, that was one of her main symptoms, was extreme fatigue. So we can't ignore anything. I think if I had my life to live over again, knowing what I know now, and I would present to a doctor, hey, I'm bloating, yeah, I'm 67, yeah, I'm postmenopausal, I would just say, I'm not leaving this exam room until you do these two things.
Good for you.
I also believe, and I know the GYN community doesn't agree with me, I strongly believe every woman, no matter her age, should have a pelvic rectal exam every single year. Now, pap smears are only for cervical. That's the only one. So a lot of women say, well, I had my pap smear, it was normal. Right. Oh yeah, I've got this pain, I've got this. And they ignore it. So I know Dorine and I and the other survivors are really hoping to get the word out. The CA or the pelvic exam, getting the pap smear is only for cervical.
Well, it's interesting because when we started this last year, when we were talking about teal and talking about ovarian cancer awareness, somebody said to me after the show, well, I get my pap smear done every year. And I only knew enough from the show to know that wasn't the answer. And I said, yeah, but that's only for cervical. But beforehand, I would have been like, okay. I mean, that makes sense to me because I was not educated. And I think women need to educate themselves. They really need to, and push back. You said it earlier, Karen. I think it's so important. We're intimidated by our physicians. We are intimidated. It is difficult for us to be an advocate, but I can tell you that you are your best advocate. And if you can't find the right doctor, speaking of doctors, hold on just a second. Perfect timing, Dr. Holloway. We were just saying, speaking of doctors.
Good afternoon. How you guys doing?
Welcome to the show, Dr. Holloway. I know your time is limited, so please introduce yourselves and tell us how you know these amazing women.
Well, I know them both as patients and friends over time, over long periods of time with Dorine, and actually a pretty long period of time with Karen now. So I'm a GYN oncologist at Advent Health Orlando, and have had them both in my practice for management of ovarian cancer over the years.
So let me ask you, we were just talking about physicians and how patients tend to be intimidated. So as a physician, what would you say to help a patient who may be intimidated by their doctor, but really, really wants to pursue something because in their minds, their hearts, their bodies, they know something's up?
So you're really talking about, someone who's not been diagnosed and is having perhaps pelvic pain or other gynecologic complaints. But I think the thing that I've seen commonly, even more than, well, maybe it's because of anxiety about going to doctors, you tend to make excuses in your brain about how this couldn't be anything and it'll get better. And sometimes the symptoms do get better. So, we don't encourage most people with any condition to be hypochondriac about it, and every time you feel a slight twinge of something that you rush to the doctor and get checked out for cancer. But any symptom really that is persistent and not going away should be checked out, sooner rather than later. And I think, when they've done surveys of patients with ovarian cancer, the average time from symptom onset to being diagnosed is usually in the 60 to 90 day range. And so it's oftentimes said that it's a silent disease, that it really doesn't give you any warning and all of a sudden you've got ovarian cancer. But when they really do surveys, patients on average have sorry, I'm being moved here. I'm out in the hallway outside a room. Patients have symptoms maybe for 3 months or more, sometimes even up to 6 months. And unfortunately, it oftentimes gets confused with other diseases, and you'll end up seeing 3 or 4 other physicians getting different testing procedures. And unfortunately, no one's ever done a simple office pelvic exam, which can detect an abnormality that would lead you in the direction. So if you're having pelvic complaints of any sort, it's important to get in and see the gynecologist and get a pelvic exam before you spend $20,000 on scans.
So let me ask you, Dorine and Karen, what is it about Dr. Holloway that makes him such an amazing physician and supporter and advocate?
Oh, he really is just an amazing man. I mean, he listens to everything you have to say. He's very, very honest. Karen had mentioned earlier about, you know, that she wasn't in chemo, and that was probably one of the first things that I told Dr. Holloway. And his response to me was, Dorine, you're going to the top of the Empire State Building. I'm going to give you a parachute. You can either take it or leave it. So I have always appreciated him, you know, just being very, very direct with me and really having my best interest at heart. And I asked him to please treat me as though he were treating, you know, his own daughter or family member. So, yeah.
It's a blessing. How about you, Karen?
Well, he's always been very gentle, very kind, sometimes has a few jokes. He's giving a hug. And he's very educational. He really explains. Now, sometimes because I'm all kind of wrapped up in my emotions, my husband hears things better. But no matter my question or concern, he's right there. And I love his hugs. And I love him. He's great.
It's so good. I mean, I hope that you hear this all the time, Dr. Holloway, but Dorine was just adamant that you come on the show. And I'm just so, it's always wonderful to have a physician who's willing to share their heart. And you obviously have made an impact on these two beautiful ladies in a big way, in a big heartfelt way. What do you think people should do what's the best way people can support or be an advocate for ovarian cancer awareness, Dr. Holloway?
Well, I think one of the best things is just get the word out that annual pelvic exams are still important. You know, there's a lot of confusion amongst physicians as well as patients. I oftentimes see patients over age 65 who have been told that, well, your pap smears have always been normal your entire life. You really don't need a pap smear anymore. And they interpret that as, I don't really need to see a gynecologist anymore. And many family physicians actually interpret it that way. And the patients quit getting a gynecologic exam. So that misses the opportunity, to detect early cancers of the vulva, vagina, which are rare, but do happen. And then, of course, the pelvic exam for detecting an adnexal mass. Now, a pelvic exam, unfortunately, is still not a great screening tool if you look at screening cancers, and that's the big problem with ovarian cancer. We don't have a pap smear or a blood test or a mammogram, so to speak, for ovarian cancer. So we have to rely on women understanding their own, physiology and feeling something is different. And, it might just be that, the bowels are a little irregular and you've got a chronic constipation disorder, and that eventually gets diagnosed. But oftentimes that can be other more serious disease. So you really shouldn't ignore any complaint in the pelvis. And, we also treat uterine cancers. And for women who aren't getting annual exams, they sometimes will ignore postmenopausal bleeding for prolonged periods of time. And that's a missed opportunity. When women present with early postmenopausal bleeding, it's usually a very early stage 1 tumor. It can be diagnosed and treated quickly with a hysterectomy. But when you let it go on for 6 months, a year, sometimes even 2 years, we see, then it's had a chance to become a more involved disease. It takes a lot more therapy. So the bottom line message, as a long-winded answer, is keep up with your annual pelvic exams. They're simple. They're very inexpensive when you can compare it to everything else we can do in medicine, and they can diagnose an early condition, just like going to the dentist every 6 months and getting your teeth checked out. I mean, it's the same idea.
So Dorine, why did you pick The Greatest Wealth is Health as the title of the show?
Ooh, after what I've gone through over the last year, that is just the most important thing to me. And, I didn't realize until I've lost certain things as a result of this, that my health really is the most important thing that I can have. So it allows me to obviously do so many things in life, and when you don't have that, some of that's taken away from you. So
yes. All right.
Yep.
So, Dr. Holloway, how can people find you? And then Karen and Dorine, I'll ask the same question because it's coming. We're in the month now. Yes. No, next month. It's pink and teal and all that, which I'm so excited to promote. How can they find you, Dr. Holloway?
Well, I mean, obviously the internet, you know, and I'm an employee and have been here since 1994, I guess, at now Advent Health in Orlando at the Cancer Center. So we have a patient care coordinator that helps with second opinions and new consults. We mostly see patients by referral, you know, for evaluation. We're not the primary screeners usually. Most women have their OBGYN or their internal medicine or family physician doc who's got a suspicion of something and then sends, you know, for a consult. But we do still see patients who call and want to be seen or get a second opinion about their condition. We have a very active clinical trials program in GYN oncology and have many treatments that are under investigation, you know, through FDA approved processes for treatments that are very, you know, difficult in recurrent settings. And we see, you know, a lot of patients for second opinions about things like that. And
how about you, Karen? How can people reach you?
Well, probably the best way is through my website, and that's Karen Ingalls Home at WordPress.com.
Fantastic. And last but not least, the one who I know, tell us, Dorine, how can they reach you?
Well, first of all, I have to say real quick, I enjoyed seeing the doctor scrubbing behind Dr. Holloway there for a moment. I know you guys keep seeing my AC guy in the back behind me, but anyhow, obviously through the internet, LinkedIn and Facebook are the two primary sources. I would love to see people post on their Facebook or whatever social media wearing teal for the month of September, and you can say, I saw it on the TED show and I was supposed to do it, so that's why I'm doing it, and I learned a little bit about ovarian cancer. So even simple things like you can get teal nail polish and do a little teal on your fingernail. So
good idea.
Yes, and we so appreciate you having us on the show and bringing more awareness to this, but I love when people reach out. So
it's a joy. You all are a joy. Thank you so much for taking time out, Dr. Holloway, Karen, Dorine. You all, if you are experiencing anything that seems out of the norm, start the process. Don't put it at the back of your mind. We don't want the hypochondriac that Dr. Holloway mentioned. But if you have this thing and you know you're feeling something different, something's changed, don't let it sit. Reach out to Dorine or Karen or me, and we'll put you in touch. They are accessible, wonderful people. All of you are. Thank you so much for everything that you do in the community. All right.
thank you very much, Ted.
Phenomenal. Thank you guys so much. Bye, everybody.
Thank you.
Have a
Bye-bye.
great afternoon.
Thanks.